I am Anastasia Jirwa, and I will be dealing with fundamental of nursing. In the first session, we have learned about health and its concept, and then we have also learned about what are the factors that influence health. In this session, we're going to learn about what are the causes and the risk factors for developing illness. Before we move on to the topic, we will first study about what an illness is. Illness is a broad term that defines the poor state of the body, the mind, and as well as the spirit. This is a personal experience and a general feeling of being sick and unwell. Many people tend to use disease and illness in the same breath. However, there are subtle distinctions between them. Disease refers to the affliction or pain of a specific organ or the entire body that can be caused due to microorganisms such as bacteria, protozoa, viruses, or it can be caused because of injury that can include falls as well as road traffic accidents. It can also be caused because of the chemical imbalance in the body, exposure to toxins, as well as the production of immature cells. The examples of disease can be cancer, diabetes, psoriasis, as well as fracture. However, illness is the reaction of the body to a disease. Illness can be represented by fever, fatigue, muscle weakness, blurred vision, and an abnormal blood pressure, which can be either high or either low, as well as the rapid heart rate. It should be noted that though illness is a feeling of being sick or unwell, however, it can also occur without a disease. Another distinction between an illness and a disease can be its specificity. A disease is based on a specific factor or criteria that a doctor or a physician looks for when a patient goes to the clinic or to the hospital to be examined. An illness, meanwhile, can refer to any disease. Also, because it is largely a feeling, it can be different from one patient to the other. Now, we are going to study about what a risk factor is. A risk factor is an attribute or an exposure that is significantly associated with the development of a disease. It is also a determinant that can be modified by certain interventions, thereby reducing the possibility of the occurrence of the disease other specified outcome. Risk factors are often suggestive. That is, the presence of a risk factor does not imply that the disease will occur. However, the absence of the risk factors also does not imply that the disease will not occur. For example, smoking is the common risk factors for developing a lung cancer. A person who has the habit of smoking is at high risk of developing this cancer. However, even if a person does not have this habit of smoking, he can still develop this cancer. So that's why it is said that risk factors are often suggestive. Risk factors can be of three types. The first one is the causative. For example, smoking can be a risk factor for developing lung cancer. The second is the contributory. For example, lack of physical exercises can be the risk factors for developing coronary heart diseases. And the third one is the predictive. For example, illiteracy can be a risk factors for prenatal mortality. In order to get a detailed idea of what this topic is all about, we are going to look on certain conditions along with their prominent risk factors. The first condition is the heart disease. A person is at high risk of developing heart disease if he has the habit of smoking, if his blood pressure is higher than the normal level. He is also at high risk of developing this disease condition if he has a high cholesterol level, if he is suffering from a condition known as diabetes, and also if he is an obese person. So, these are certain risk factors that can lead an individual to develop this disease condition. The second is the cancer. A person is at high risk of developing this disease if he has the habit of smoking, if he has the habit of consuming alcohol or is an alcoholic, if he is daily exposed to the high level of radiation, if he is constantly breathing the polluted air. For example, if a person is constantly inhaling the polluted air, or if a person is constantly exposed to the dust particles, it can lead him to suffer from various respiratory infections, or it can also lead him to suffer from various types of cancers such as tracheal cancer as well as the lung cancer. The dietary pattern which we follow in our day-to-day life also plays a major role in helping us attain a good health status. A person is at high level of developing stroke if he is having the habit of smoking, if he's having a high blood pressure as well as the high cholesterol level. The next is the motor vehicle accidents. Various factors can lead to motor vehicle accidents, which includes alcohol. If a person drinks and drives, it can lead to various accidents. Alcohol affects the mental status of the individual, and this can lead to the impairment in his skills. That is, it can affect the thinking, the judgmental, as well as the controlling of the individual. That can probably lead to many kind of accidents. The speed here is also one of the major cause for these accidents. If a person is driving in a speed that is above the normal level, or we can say over speeding, this can lead in the loss of balance as well as loss of control and can lead to accidents. It is always advised that people should use seat belts because we may experience certain incidents whereby a certain brake must be applied. And if we use these seat belts, it can hold us in the same position and prevent us from injuring ourselves. Next, we are going to study about the risk groups, or we can also say the target groups. Here, the people can be divided into various groups depending on their age, their gender, their customs, belief, or their health condition. These people can be at high risk of developing illness depending upon their biological situation, physical situation, as well as their social cultural factors. The biological situation consists of the age group. as we know that the newborns and the older adults are at high risk of developing illness because they have a low immune system compared to the adults. So this can be one of the cause that can lead a person to develop from illness. Also, we can see that toddlers are more prone to accidents than an adult is. So here, the age group also plays a major factors in determining an illness for a particular age group. The second is sex. Here, we can also see that there are certain conditions which affect the female more, as well as there are certain conditions which affect the male more. For example, female are more prone of developing breast cancer, as well as males are more prone of developing lung cancer. The third factor is the physiological state of an individual. For example, anemia is more common in the pregnant woman. The next is the genetic factor. Here, genetic also plays a major role in developing illness. For example, a family who has the history of mental retardation, diabetes, as well as mental retardation can also lead the future offspring to also develop from the same kind of diseases. There are certain other health conditions that can also lead a person to suffer from illness. For example, high blood pressure can lead one to suffer from stroke. So these are the biological situation that can lead one to suffer from illness. It includes the age group, the sex, the physiological state of a person, the genetic factor, as well as the other health condition. Now, moving on to the second situation, which is the physical situation. Here, the environment and the surroundings in which one lives also plays a major factor for one to develop from illness. Here, if the person is living in the rural areas or the villages in which the hygiene is not properly maintained, it can lead them to suffer from malnutrition. If a person is living in the urban state, it can also lead them to suffer from coronary artery disease. Also, if they lived in a place which is overcrowded, it can lead them to suffer from various kinds of disease such as asthma and other nutritional deficiency, which can lead one to suffer from kwashiorkor or marosis. Here, the environment in which one lives plays a major role for one to develop illness. If a person lives in a surrounding which is polluted by the air, water, or sand, it can lead him to suffer from various kinds of diseases. If a person is exposed to an environment which is polluted by air, it can lead him to suffer from many kinds of respiratory disease such as asthma or bronchitis. However, if the person is constantly consuming the polluted water, it can lead them to suffer from conditions. So here, the environment in which one lives in plays a major role in determining the health condition of the people. Therefore, one must make sure that the environment is clean and he should also maintain the hygienic practices. Coming on to the last factor, which is the social-cultural factor. This factor is largely determined by the belief, the culture, the education, as well as the income of a person. The social-cultural factor includes the social class. For example, high-class people are more prone to develop coronary artery diseases. The second is the ethnic and cultural group. This includes of family disruption. If the family members is always stressed, it can lead to the deterioration of the mental status of an individual, which can further lead him to abstain themselves from the normal activities or the normal living conditions and can lead them to suffer from various other kinds of diseases. If the person is not educated, he will not be having a proper knowledge of how to maintain his health, and it can lead him to suffer from various kinds of diseases and can also lead to death. The environment as well as the place which they lived in also plays a major role in determining their health. Their lifestyle practices can also have a major influence in their health. If the person is not eating a proper kind of food or if he is not maintaining a hygienic practices, it can lead them to suffer from various respiratory as well as other kind of diseases. Here, the customs, the habits, as well as the behavior which one follows also plays a major role in determining their health. If the person is into drug abuse, smoking, or alcohol, if he is not performing any physical activities, or if he is overeating, this can lead them to suffer from various kinds of conditions. The access to health services also plays an important role in determining their health. The more access the people get to the health services, the more healthy they become. If the person is not having any of the access to these health services, he will not be knowing what is the condition he is suffering from or what are the other major disorders that these conditions can lead to. Therefore, he will not be receiving treatment at the proper time, and this can lead to further deterioration of their health condition, or it can also lead to death. In order to prevent themselves from suffering from any kinds of diseases, it is very important for them to have a good knowledge, to follow a good dietary pattern, to perform physical exercises, and the most important thing is to maintain the hygienic practices. Most of the condition that cause a high proportion of the early death or the ill health are related to the modifiable factors that affect the health. So we must be very careful with which factor to adopt and which factor to follow in order to maintain a good health. So we have come to the end of this topic. Today we have learned about what is illness, what is the difference between a disease and illness, what is a risk factors, what are the risk groups or the target groups, as well as what are the types of the risk factors. Here we've come to know that there are three main types of risk factors, and these are the causative, contributory, and the predictive. We have learned about the prominent risk factors of certain conditions. We've also learned about the risk group or the target group, which can depend on their biological situation, physical situation, as well as their socio-cultural factors. I hope you have understood this topic. We will be meeting again in the other session with the other topics, which will be very important for us to gain a knowledge in order to improve our health. Thank you.